We are back on Kababayan Today. We are paying tribute to our Filipino-American nurses and all the work that they do for our community. It's International Nurse Day in May. So we have our panel. Thank you so much for coming on the show and talking about your experience as a nurse and what it takes to be a nurse. You know, you've got to, there's a special combination, as they say, you know. So let's talk about the organizations that all of you are a part of and the work that you do. Okay,
so,
Charmaine?
So for myself, I'm with United Nurses Association, abbreviate UNAC, UHCP. So we represent healthcare professionals across Southern California. And I'll go back to how my relationship came into with FAHWA and FMC. So with the work that we do, we're a union, organize healthcare professionals across the country to protect their wages, benefits, pensions, make sure their needs are heard for safe patient care, making sure that themselves are safe in the workplace. But at the same time, we also promote them going out into the communities, doing things. What do they do in their personal lives? Are they volunteering somewhere? Do they go out on medical missions? Are they part of the PTA? Do they do outreaches with their churches, helping the homeless, things like that. So with us promoting our members doing that, I was able to become in contact with FAHWA and FMC. A year ago, some of my coworkers who are affiliated with them invited me to the NAFCOM assembly. So I went there, and then they asked me to speak, and we had actually just did a fundraiser for Typhoon Haiyan. So our members raised $20,000 themselves, and we matched it. So we were able to give the victims of the typhoon $40,000. And it wasn't having to go to the government. It went through the churches, so making sure that the people there were actually getting it. So, and part of doing that, we found that working with Shalom and Marietta and the others, that there's more outreaches there. So what we do with our members is say, look out there, see what organizations are out there, tell us what it is, because you can promote you as a nurse, healthcare professional, you're so respected in the community, and tie it, whether it's within your backyard, whether it's across the country or outside of the country. So we want them to be able to do that work.
Thank you very much, Charmaine. And let's talk about FAHWA. Are a lot of the Filipino nurses part of this organization? Because I know that there are a lot of nurses and yet they don't belong to any association when it comes to their Filipino-American community. Marietta?
Not yet, but we're doing organizing, and we're taking it step by step. I know in my hospital at Good Samaritan, we've been doing a lot of fundraising for the Manubu tribe in Davao. When I first went on my medical mission, it was for FAHWA, in alliance with Panaghiusa, which means unity. And it was a medical mission mainly for the indigenous people of that area, the Manubu tribe. And then my second medical mission came after Typhoon Haiyan. And that was with the Alliance of Healthcare Workers based in Manila and Quezon City. And we went to Leyte. And that was just one of their many medical missions during that time. The first one was attended by our vice president then of FAHWA, Chiro Quijano, and he went to Eastern Samar. And that's when the storm hasn't quite abated yet. They were having a lot of rains, and so they took the brunt of the inclement weather, and he came back and you know, kind of gave us an up-to-date of what was going on.
Right.
And that's when we did organizing for not only just medical missions, but supplies.
Yes, because it's so important to be able to give back to that community.
Yes.
Shalom, manawagan ka sa ating mga kababayan ng mga nurse na hindi pa part of your organization. As we know, there is power in numbers.
Before I say that, can I say a few words about...
Yes, of course.
First, I'd like to impart to all the nurses that, or to all the Filipinos here in the US, that first, we are Filipinos, and second, we are nurses or doctors or dentists or physical therapists. And as a Filipino, the problems that we face here in the U.S., the exploitation that we suffer here, are no different from the exploitation that our Filipinos in the Philippines suffer. Maybe a difference in intensity, severity, depth, and scope. And so there's a basis for us as Filipinos to work together,
Absolutely.
extend solidarity to each other, and work together for the benefit of our country.
Right.
And as nurses or health professionals, we have those skills that we can make use of.
Yes.
And I'd like to call on all these nurses, doctors, dentists, and other fields of health sciences to organize and to join FAHWA in our struggle, in this journey, to build hopefully a better future for the Philippines.
Thank you very much to our panel. I would like to invite you back here on the show for our nurse panel. Once again, there's still so much to talk about. Thank you for being here. You will see them in our next show next week. So abangan niyo po sila. Maraming salamat po. This is G. Tanji, Kababayan Today.